What's up, Mom and Dads, and welcome to Pediatrics 101. Today our topic is about adolescents and them being at a higher risk for getting into a motor vehicle accident. We're going to talk about some injuries and treatment associated with the accident and how you can prevent this from happening. We're going to start by talking about adolescence, or the teenage years. Teenage years, sounds fun and lots of adventure. Perhaps no other period of life is as exciting and bewildering as adolescence. It is a time for experimentation and self-discovery, road trips, alcohol tasting, and McDonald's runs. Your teenage years are for first kisses and stupid fights and silly pictures you'll be embarrassed by in 10 years. This is probably giving you a major reminiscing episode and which is likely making you blush now. Adolescence, or teen years, is a time of being in between a transitional stage from childhood to adulthood. The World Health Organization defines adolescence as those people between 10 and 19 years of age. It is a period of intense growth, not only physically, but emotionally and intellectually. They are starting to learn how to become responsible and independent, which means you, as a parent, should give them support and some freedom. One example of having independence is handing your car keys for them to finally learn and fulfill their dream of getting their driver's license. Having that official piece of identification tucked in their wallet opens up a new world of choices, responsibilities, and freedom for them. However, car accidents, or MVA, are the leading cause of death and injury to adolescents. In 2018, Transport Canada reported that 124 teens between the ages of 15 and 19 were killed in road crashes, and over 12,000 were seriously injured in Canada. Teaching your teen to be a safe, careful driver can make the difference in their survival behind the wheel. So, what is it about teenagers that makes them at high risk for motor vehicle accidents? A very obvious reason is being an inexperienced driver. After teens pass their road tests and get their long-awaited license, some incorrectly believe that they are experienced drivers and well knowledgeable to every challenging situation in the road, which is not the case. Young, inexperienced drivers show an underestimation of the road situation or may not be able to apprehend dangerous situations. Due to a lack of experience in driving, adolescents are more likely to act impulsively or make impulsive decisions while driving than an adult would. Young drivers also tend to make impulsive decisions while driving when friends are around. In adolescence, peers are more likely to influence decisions due to what we all know as peer pressure, in which risky friends or peer passengers may also influence unsafe driving. Other risky behaviors while driving is not using seatbelts. The use of seatbelts is essential not only for the driver but also for the passengers. Transport Canada statistics in 2018 reported that 29.4% of drivers and passengers died, while 10.8% attained serious injuries were not using seatbelts. Adolescents are also easily distracted. Scientific studies and ongoing research are consistently revealing that adolescents can't truly multitask as well as they believe they can because a part of the brain is not fully developed yet. Distractions like the use of mobile phones while driving, listening to music, and having a very active children or a group of teens in the car increase the incidence of road traffic accidents. These distractions can cause a significant reduction in the performance of young drivers. Canada Safety Council stated that texting while driving increases the risk of being in a collision by 23 times. Using a cell phone with or without a hands-free device increases the driver's reaction time, therefore, the risk of crash not only for the driver, but also for the pedestrians. In addition, at this developmental stage, alcohol and substance use tend to start. They may underestimate the harmful effects of alcohol and other substance consumption with their driving skills. Teenagers under the influence of alcohol and other substances impose a high risk of motor vehicle accidents to themselves and other people. Alcohol not only impairs the condition of safe driving such as vision and reaction time, but may also have an effect on judgment and therefore may be an indication of high-risk behavior such as speeding. Adolescents are at a point where they are developing into an adult, and so driving is a new skill and responsibility for them. If driving is not taken responsibly, then serious injuries up to death may occur. That leads us to our next point, injuries acquired from MVA. There are a variety of injuries, both fatal and non-fatal, that may result from an MVA. Although unintentional, injuries sustained in an MVA can range in severity and are dependent on factors such as airbags, seatbelts, the speed in which the vehicle was traveling, etc. The severity of the injury dictates the amount of recovery or if there will be a recovery at all. The most minor injury your adolescent can get is scrapes and cuts. They may receive cuts from the impact of their vehicle or the other vehicle, or they may get hit by loose projectiles in the car like their phone. Traumatic brain injuries often occur whether it is a concussion or a severe head injury from hitting the windshield, side window, roof, steering wheel, loose objects, or other people. If not treated properly, traumatic brain injuries can cause long-term problems with brain function as well as headaches and sleeping difficulties. The same comes to facial injuries, which also involves hitting the face on different aspects of the vehicle. Car collision impact usually causes neck and spine injuries, caused by the sudden jerking motion. Whiplash is the most common MVA injury. It results when the soft tissue, the muscles, and ligaments of your neck extend beyond their typical range of motion. A person's neck and spine can be injured to the point of reduced sensation of and control over their arms, hands, legs, feet, and other body parts, or in more severe cases, loss of function due to significant nerve damage. Although the use of seatbelts can save lives, the impact of it on a person's chest can cause breaks, leading to rib injuries. Internal bleeding may also occur, which is a serious medical emergency. Adolescents can also suffer from post-traumatic stress disorder, or PTSD. PTSD is defined as a psychiatric condition that can result from experiencing or living through traumatic events. 2 to 46% of adolescents will experience PTSD in the first 4 months. Additionally, 13 to 25% will experience PTSD 4 to 12 months following the accident. In addition to PTSD, a person may suffer from other psychological injuries such as panic disorders, anxiety, depression, and lifelong fear. You might feel a great deal of guilt. All of these kinds of mental distresses are very real injuries that can result from a car accident. Keep in mind that some injuries do not show up immediately after a car accident, like PTSD and brain traumatic injuries. This is primarily due to our body's reaction to trauma. Depending on the nature of the injury, it may take days, weeks, or even months for symptoms to appear. So, if you or your child were in a car accident, it is best to seek medical treatment for even the slightest discomfort or early indication of injury. Now let's talk about different treatments for all of these injuries. Treatment and length of recovery for MVA injuries vary depending on the extent of injuries suffered. Treatment involves a multidisciplinary team, meaning multiple healthcare providers, the family, and school are involved with the care. Treatment consists of developing a plan with health professionals to assess for injuries using X-rays, CT scans, MRI, EMG, and many clinical examinations, and then to address the symptoms present followed an MVA. Your teen needs to participate in a lot of surgeries, therapies, and medications for healing and recovery. Some of these treatments are surgeries, like reconstruction of the bone, removing punctured foreign objects to the body, spinal surgery, skin grafting for burns, and many more. A person may get multiple surgeries, again depending on the injury acquired. Casts and splints are used. Both are orthopedic devices that are used to protect and support fractured or injured bones and joints. They help to immobilize the injured limb to keep the bone in place until it fully heals. Bracing. It provides support and stability while ligaments, muscles, and bones are healing following injury, allowing patients to slowly return to their normal activities by restoring strength and function. One example is neck foam collars. Are soft foam collars used for whiplash to help reduce pain in the neck by limiting the movement of the neck. It is important to start walking as soon as you can after your surgery, if indicated, but you will need support for walking while your leg heals. Crutches may be a good choice to help you get around without putting any weight on your injured leg. Next is undergoing a concussion management. The goal is to manage symptoms such as dizziness, nausea, light and sound sensitivity, cognitive defects, and neck pain. A person will experience challenges and difficulties, so an occupational therapy will be needed. Assessment is completed to determine if there are any cognitive impacts of the MVA on the patient due to concussion or head trauma suffered. It helps people to take part in everyday activities and live better despite the injuries. Pain medication are also administered to soothe pain and allow patients to participate in therapy. Medication like acetaminophen and ibuprofen can be used to treat mild to moderate pain. For severe pain, a physician might prescribe certain antidepressant and/or opioid medication. Muscle relaxants, to soothe pain in muscles, can also be used to improve sleep cycle if pain is stopping patient from sleeping. Acupuncture can be an option to target muscle points to manage pain. Anticonvulsants, most commonly known as anti-seizure medication, is also prescribed after a traumatic brain injury. Drugs like phenidine is given during the first week after TBI to manage post-traumatic seizure. Manual physiotherapy or chiropractor therapy will be prescribed in addition to medications. It involves doing exercises or having part of the body massaged, warmed, or manipulated in order to decrease pain and restore joints back to their normal function. A person will undergo psychotherapy for trauma healing. Mental health professionals provide support for patients experiencing PTSD from MVA by assisting with symptoms of post-traumatic stress, depression, anxiety, and dissociation. During this time, your child will need lots of support and attention. It is important to follow prescribed treatment and medication for their recovery and to maintain quality of life. As mentioned, adolescence is a developmental period categorized by behavior that involves taking risks. As a parent, you spend years protecting your children from all sorts of danger, and now you face the prospect of handing them the keys. You can help mold your teens to become a safe and capable driver and help prevent and minimize the risk of motor vehicle accidents. It's an effort that takes time, knowledge, and patience. Here are some tips for you. First, promote and enforce the use of safety devices, such as the use of seatbelts for injury prevention. According to a study conducted in 2014 by a few physicians, when belted drivers crash, they are of lower severity than crashes of unbelted drivers. Wearing a seatbelt reduces the risk of serious head injury by minimizing the impact of the force. Seatbelts save about 1,000 lives a year in Canada. More lives could be saved if everyone buckled up for every trip. Second, knowing the importance of safety laws. We found out that the majority of road accidents resulted from errors in attention, visual search, speed relative to conditions, hazard recognition, and emergency maneuvers. Road safety laws should be properly explained with emphasis on general awareness about safety constraints and safe driving as primary preventive measures. Following speed limits, checking blind spots before turning, and following traffic lights and signs are essential prevention of accidents. For young motorists, parents need to make sure that their children are aware that they must obey all traffic signs and signals. Next is limiting distractions. Limiting distractions would help teenagers focus and concentrate more on the road. A parent should teach their young drivers to limit phone use while driving. Talk to your teen about putting their phone on silent and away from reach while they are driving, and remind them that it only takes a split second of looking at the console to choose a music or check their phones for conditions on the road to change without them noticing. Fifth, providing strict and clear teaching on the dangers of alcohol and substance use. Current drug abuse reviews found that hangovers impair your reaction time, memory, attention, and ability to organize and plan. Alcohol and drug intoxication can affect a person's concentration and memory for up to 48 hours or longer. What you can do are debunk myths. Adolescents think about drinking and drugs make them popular or happy, but let them know that alcohol might only make them feel high, but it's a depressant, which means it can also cause sadness, anger, and impairs judgment. Establish rules and consequences. For example, leaving parties where alcohol is served and not riding in a car with an intoxicated driver. Do not drink and drive. This is involved not only in cars but on motorcycles. Next is the importance of sleep. Teenagers shouldn't underestimate the power of rest and sleep. It is found that getting adequate sleep to stay focused and improve concentration, while inadequate sleep poses a risk of safety and performance. It is recommended that adolescents get 8 to 10 hours of sleep every day. Parents should set bedtimes and provide a curfew and restriction for night driving. Lastly, be a good role model. Remember that your child looks up to you, so practice safe driving yourself. Be a good example and get involved in their driving habits from the beginning, and stay involved for the duration of their teen years. Alright, let's do a quick recap. Ages 10 to 19 or adolescents start to become more independent during this developmental stage. Parents start to give them freedom, and one step to do that is to let them drive on their own. However, car accidents or MVA are the leading cause of death and injury to adolescents. Some factors like being inexperienced, risk-taking, impulsivity, not using seatbelts, easily distracted, and alcohol and substance use makes them at risk for MVA. Injuries acquired in MVA can be fatal or non-fatal. Most common car collision injury is whiplash. Minor injuries can be scrapes, cuts, and sprains. Some major injuries that can lead to death are traumatic brain injury, neck and spine injuries. They can also suffer from psychological injuries such as post-traumatic stress disorder, anxiety, and lifelong fear. Treatments for this injury depends on its severity. Treatments focus on healing, symptom relief, recovery, and continuity of quality of life. Surgeries, multiple therapies, medications for pain, and seizures are needed. Actions you as a parent can do to prevent MVA involving your teens are reinforcing the needs of using seatbelts and importance of road safety rules, limiting distractions, stressing the dangers of alcohol and substance use, and the importance of sleeping and being a good role model. Teenagers need to realize that any risky behavior that they participate in can endanger the life of other road users. And as a parent, you need to continually give guidance and be a good example to them. Thank you for watching. If you like this video, make sure to subscribe to our channel so you'll get notified when we publish new videos, and we'll see you on the next one.